Okay, so let me just try and sum up there. We are operating in an environment in which paid-for advertising is far more restricted, if not by direct rules, then at least by a sense of the public service being asked to think much more carefully before it spends money on advertising. Yeah. We know that the relationship between what we do externally and the direct impact on volumes is somewhat complex. We are confident that the use of our service is of benefit to the NHS more widely, and therefore we mustn't let this sense of being restrictive reduce our ability to provide information to the point that the cost is borne by the wider NHS because we're keeping our heads down. So the board, I think, wants to encourage the executive, the board as a whole wants to encourage the executive to think creatively about how to make sure that the public is appropriately aware of the service that we offer in order to deliver the benefit which we offer to the NHS and to bring that about. But we recognise that it is not a question of blanket advertising, and we recognise that the alchemy between information and call volumes is a difficult one to predict. But let's just make sure that the value that we add to the NHS is fully utilised by ensuring that the public, as far as possible, knows that we're here and what we can do for them. Okay, I'm looking at the agenda. Oh, Sue, I'm sorry.
I just have one question and I'm just trying to understand the explanations. In the performance report, we say that we've missed some of the less and non-urgent calls, KPIs, because of low nurse fulfilment. And yet when I look at the KPI scorecard, under the recruitment and retention, we've got projected fulfilment of nurse staffing requirements at 112%. And my understanding of it was we were sort of holding on nurse recruitment and we've got lower call volumes. And to me, there seems to be an inconsistency in the explanation.
Presumably that's a timing issue. Renee?
That is a timing issue of when the resource is available, which I'll cover in more detail when I give the review of where we've got to in roster options.
Okay. So it's about roster and matching supply and demand. Okay, I'm looking at the agenda now. There isn't a slot designated for finance. So there are slots designated for CRB, major programme reports and rostering. So it's just a question of what's the most logical order.
Finance now.
We'll take finance now then.
Okay. Key headlines: 15,000 surplus for the month. Shortfalls against budget target. In terms of income, the main issue for us is around the locally commissioned service, which is a reflection of the contracts that we've lost and are forecast to lose during the course of this year, which we've recognised, worked hard to actually quantify and establish the underlying issue for us in terms of financial value this year, and we've worked together with colleagues to put together an action plan in order to fulfil the income shortfall and to cover any income reductions as a result of call volumes reducing. Part of that has been to freeze and lock in underspends from Q1 as previously reported. We've established our contingency reserves that we've got in place from the start of the year, and we've levied a further savings target across all business support and non-frontline services equivalent to 9% of paid budgets, and we have had savings schemes coming back against those savings targets. So those will be reflected in budgets from September as part of our mid-year review, and we will be putting that and reporting that within the September report. I believe overall we will be in a position at that stage, I would hope to actually see a reduction in the risk rating that we've applied to our financial position forecast for the end of the year. So I just wanted to give the board the assurance that we recognise where our issues are, we've acted on it swiftly, and all colleagues are signed up to delivering our financial performance by the end of this financial year.
Sue? No?
No.
Excellent.
I just heard.
Peter?
Well, it's just that I thank you for that. That's reassuring. I do think that is a reassuring comment. But I'd say we are backloaded in the year for these financial savings to come through. I mentioned it last time, and I do think perhaps in the next meeting we could just have a bit more about how assured you are of delivering those, because we can be caught very cold with that.
Yeah.
Thank you.
Good points, thank you very much. Nick?
It actually builds on that, I think, Peter, because the judgment that I took together with particularly Renette, Roger and Trevor we face a reduction in the forecast volume of calls that are coming in, and the financial effect of that is a reduction in the income coming into the organisation. Actually, at the start of the year, in our business planning and then looking at the risks and potential mitigations, we identified that that was a possibility. And at that stage we said, well, it's very easy in concept. If we see a reduction in calls, we would reduce the capacity to answer and handle those calls, and that will reduce the costs, and therefore that's the mitigation. In fact, what we've done is to leave the frontline staffing budget exactly as it was based on the call forecasts at the beginning of the year, and have not downrated frontline staffing budgets in accordance with the reduction in the call forecasts. Essentially, that's for a number of reasons. The first is not to destabilise the frontline when actually we're doing a load of other things as well. Secondly, it may be that some of our volume communications campaigns will come into being, and therefore we would be foolish to have cut our capacity even further. Also, as you point out, there are a number of productivity gains that need to come through during the course of the remainder of the year. And if what we had done is reduced frontline staffing by a substantial amount, then that it would have added to the risk of non-delivery of those. And finally, we've made a potential problem into an opportunity, because we'd set ourselves a target of reducing our management overhead cost by 30% in terms of run rate by the end of this year. And by taking all of the extra 2.3 million that we need to find this year out of management and overhead cost areas, I think that we will be very near to that 30% target that we've set ourselves. So I think we took all of those factors into calculation in deciding how to respond to the reduction in volume that's forecast.
Louisa.
And I'm almost embarrassed to ask this question, but why have we got a drop in volume of calls?
Two reasons. The first is that we have seen some contracts, locally commissioned services contracts.
Oh, so it's out of those. Okay.
So that's one impact. And the second is that relative on the 0845 service, we've seen a small decline during the course of this year. And essentially what we've done is we've said, rather than go with the forecast that was made at the beginning of the year, we will forecast on the basis of the trend of the first 4 months.
But the local commission services are part of that, I understand.
So it's those two elements. Somebody help me out in terms of the numbers. They're about the same proportion. 0845 numbers and locally commissioned service drop off.
Yes, it is about the same. It's higher proportionally for the locally commissioned services in terms of the drop in call volumes, because there's less of them. And that's where we've lost contracts.
Right.
Or contracts have been ceased and might come back in the core service, as it were.
Okay. Thank you. Shall we then move on from finance, unless anyone has any more questions, and go on to pick up the rest of the performance issues? Help me out with some with a sensible flow through here. So I've got sickness, CRB. Should we do those next, Roger?
Thank you, Chair. Can I table an amendment to table 2 in the report, where I failed, or the July and August figures failed to be transposed for those eagle-eyed of you who spotted them, Nick? So can I pass that round? And apologies. And I particularly want to do this because these are perhaps the most important 2 columns in the report. So I'll pause before I continue.
Okay. Well, as you know, I'm resolutely against tabling any papers in the meeting. But I kind of let you off because I didn't notice that it didn't have the right figures in it. So I think
definitely apologise.
I think you win on that one.
Really regretful. I shall continue anyway.
Don't be put off your stride.
No, I'm not.
It's the heart of the matter we needed.
Yeah, and the point is that we are experiencing the flattening out of sickness as we have over the previous years during the summer. But as you can see from that table, at a lower level than the previous 3 years, and I do put that down very much to the management activity that's been taking place since the beginning of the year. And so the challenge for us now, as we go into the autumn, is to continue for sickness to decrease and to work hard at that flattening out by continuing with the things that we're doing at the moment, and anticipate some of the really positive changes that will come through the rostering options work, and particularly for me through the first line management restructure, which we'll be hearing about later. I think when first line managers are finally appointed in November, that we will be able to see a continuation of that fall. So unless anybody has any questions, I'll take the report as read.
Any spares copies of the
Yeah.
to the public?
Can I just comment? I think that what this shows is a 20% reduction in sickness. Not 20 percentage points, but 20% reduction in sickness that has now been sustained through April, May, June, July and August.
Not quite June, no.
Yeah, on average, yes. But we really have to stay on the game, yeah, absolutely. We cannot let it slip.
Yes.
We know what happens as soon as we let it slip.
Okay. Thank you. Louisa.
I remember previously there was discussion around an external organisation sort of being involved. Is that still happening?
Yes, it
I
is.
see somewhere around here it got on one of the...
It is. We are at the selection process. Unfortunately, the organisation who we were very keen to come on board with us did not put in a bid. So we do have to make some decisions about what we do about that.
Do we know why that was?
We don't actually, no. No, we will go back to them and find out, but we don't know why.
They weren't set up to do bids. That's not
They
the
weren't
way.
set up to do bids.
Yeah. They feel that they win their business through other mechanisms, and since they are keen to get into the public sector, that is something that they will need to address quite urgently, we suggest.
That is seriously disappointing.
It has been quite interesting, if I might, Chair, as we've been moving around which divisions. We wanted to pilot it on one division, and we started off thinking that the North Division would be a good pilot site. The North Division immediately started to improve its sickness. Then we changed that the South West and Midlands Division should be the pilot division. It is now the best performing sickness division. So we've now gone back to saying that the North will be the pilot site to see what impact that has on sickness. But I think, as Roger said, we are hoping that the continued focus on making sure that we are supporting our staff to be able to work will continue with the reconfigurations that we're doing and the investment that we're making in the training and development of our managers.
Okay, thank you. All right. Roger, would you like to carry on to CRB?
Yes, I'll take questions on CRB check. It's a very simple report. If there are any questions.
No questions.
Thank you.
Very good.
My lord, fantastic. Okay. A paper was circulated slightly later than the rest of the pack on most programme reports. So, didn't have a separate front sheet, I think. Who is going to take the lead on these?
That would be me.